Okay, we're on.
Hi, everybody, and welcome to the HIM Entourage podcast. This is Kendra Sabree, and I'm here with Liz Wilson. Liz, do you want to take a minute to introduce yourself?
Sure. Thank you, Dr. Sabree. So my name is Liz Wilson. Thank you so much for having me and for joining us today. I am the Program Director of Health Information Technology and Health Information Management at Beale University in Bangor, Maine. And I also work in the field. I like to do a little bit of auditing on the side. So that's a little bit about me, but I will let Dr. Sabree guide this interview.
No. So can you tell us some of your credentials and how long have you been in HIM?
Goodness. Okay. So let me date myself here. I have been in HIM roughly around 15 years now. I initially started out, my first career, I should say, was in diagnostic imaging. And I had been in diagnostic imaging for about 15 years. And then I had a career change where I segued into health information. So the reason that came about is for anyone who works in any allied health or direct patient care, they know that after a few years, as you get a little bit older, your body just doesn't want to do the same type of, work because it's challenging. Yeah. It's difficult. And so I decided, well, I need to make a career change. And how do I do that without losing any of the knowledge, the skill set, or wasting, so to speak, the education that I had? And so a friend of mine introduced me to health information. She actually said, well, if you have all this anatomy and physiology and medical terminology in your background, why don't you just get into health information? And I had no idea. I actually remember saying to her, health what? I had never even heard of it.
Right. So was that friend an HIM professional?
So she was not. But because she happened to be in a place in her life where she was looking to make a career change, she went to her local, it's just a career center. I actually live in New York State. So it was a career center in our county in New York that helps people to get job placement and some training for new career prospects. And so that's how she heard about it. So she was basically told, there's the state of New York is offering to pay for people to enroll in 2-year and associate degree programs for health information. All you have to do is go to school, get your degree, and then you'll be placed in a position. And so I thought that was great. And she shared that with me. And that's literally what I did. I just signed up. I went to school. It was fantastic. What an opportunity. And it was such a hidden gem. Most people don't even know about these things. You literally have to go to like your labor department, your local labor department, labor office, and ask them what incentive programs are there? What kind of initiatives is the government paying for to help people to develop new skill sets, maybe to further their education. And you'd be surprised how many opportunities people aren't even aware of.
I agree. And that was back then. And HIM is still one of the most in-demand fields. So I've recently seen students or professionals discover HIM the very same way.
Yeah, it's very interesting because it's a field that there's so much demand for professionals to fill all the different roles that make up health information. And I can go into a little bit about that as well. But unfortunately, it's not very well advertised. I guess we could look at the pros of that. But the positives is that since it's not widely saturated, there's so much employment opportunity for all of us. But at the same time, it's very difficult to fill the roles that there's so much demand for. The employers are the ones who drive the industry, so to speak, because they're the ones who communicate what the needs are. And as technology changes, and you know that today technology seems to change like literally every couple of months. As technology grows and changes, our health information field also changes. We need to adapt to that by ensuring that our health professionals, our graduates, all of those people that are being prepared to work in the field, that they really are up to speed with not only the different software and tools that they'll be using, but to understand just how hospital systems work, how revenue cycle works, how medical coding works, to have a really good foundation about all the little niche type of specialties that there are. If you're, you might be somebody who just wants to do one thing, and that's fine. But the beauty of health information is that it's almost limitless. You can literally do so many different roles and with the credentials that you earn.
No, you're absolutely right. But we're going to hold that thought right there, because you just said a lot that I would love to unpack. But first, tell us about that first role, your first role in HIM. Was it after you graduated, or did you transition before while you were still in the program?
Yes. So I had some great advice from my spouse at the time. And his advice to me was, do not wait until you graduate to go knocking on people's doors and asking for work. And so obviously I didn't have my credential at the time. I didn't have my degree yet. And so it was very difficult. But one thing that he added was, don't be afraid to work for free. Start volunteering. I literally went to my local hospital. I said, I will work for free. I will come every evening. I will come on weekends. I just want to learn. And well, thank goodness they had a volunteer department. I signed all the paperwork. I got my tetanus shot, my TB, whatever, everything they required. And then I just shadowed until I could learn and do things independently. I worked in the medical records department first. And I worked there for, I would say, probably 8 months while I was going to school in my second year of school. And wouldn't you know it, the moment I remember I was just 3 months shy of graduation, they said, by the way, we have a position open. We'd like to offer it to you. And so my first paid position was working as a medical coder, an entry-level medical coder in the health information management department.
Right. And look at how you got your foot in the door. We still give people that same advice. Don't be afraid to volunteer your time to learn, because typically it pays off.
It really does. If anything, it really shows the employer that you are hungry for it. And, we all have to make sacrifices in life one way or another. So it is a sacrifice of your time and your energy, but look at it more as an investment. In other words, the return on that investment is going to be huge.
Right. We invest time and money all the time. So why not in terms of pursuing our education?
Yeah, so that was my first break in health information, and what an amazing journey it's been.
Okay, so did you land there because that's the position that they had open, or did you already know at that time that you wanted to be a coder?
So I didn't know enough about coding except the concepts they taught me in school and some practice in a few different medical specialties for inpatient and outpatient. So I had a little bit of exposure, but I didn't really have hands-on real training. Okay. And so when I was in that medical records department, I was told right away they had a position open in the health information management department for an entry-level medical coder. And because I had been with the department, even as a volunteer for so long, and I was doing so well, they felt that it would be best to hire internally, so to speak, even though I wasn't officially an employee, because I had already been trained in all of their systems, their protocol, their policies and procedures. And for the employer, it was cost effective. Why take, I hate to sound like we're excluding outside candidates, but from their point of view, it's a cost savings measure and it's also a quality measure. If they know the quality of your work and they know that you're already trained for potentially for the role, then it would make sense to hire that volunteer as opposed to spending money to do an external search.
That's right. They've already invested that time into you too.
Exactly.
Okay. Well, thank you. Oh my goodness, that is fantastic. So we talked a little bit about finding your niche. Tell us a little bit about, over the years, what other aspects of HIM did you have an opportunity to explore?
Yes. So it's been a very exciting journey. twists and turns all along the way. But it literally started right there with that first paid medical coding job. And what was great about it, and again, I'm going back 15 years. At the time, our health information management department consisted all of medical coders, inpatient, outpatient, emergency department, and I remember even a cancer registrar. But what we didn't have was auditors. We didn't have any auditors. And I remember the compliance officer speaking to my supervisor and saying, you know, we need to establish an auditing program. Who do you have in your department that you think would be best suited for that? And I remember my supervisor was gracious enough to give me that opportunity. She said to me, well, you know, I love the fact that you're detail oriented. And, you know, most people in health information really are detail oriented. It's kind of like the nature of the roles. And, you know, I had an eye for detail, and I like to look for discrepancies in the documentation, and I like to investigate. And so she said, you know what, I would like for you to give this a whirl. Can you come up with just a generic plan on how we can audit our outpatient clinics? And at the time, the hospital had, I think it was 17 outpatient clinics. So this was, it sounds like a daunting task, but you start off slow, you know, in stages, you plan. And I said, okay, well, you know, the first thing I need to do is I need to learn how to really audit. I've got a lot of theories, but that's not going to help me. So one of the things that I did, and the hospital was great about this, they said to me, we will pay for you to get your credential. And at the time, the auditing credential that I thought would be most appropriate happened to be under the AAPC. Now, they used to be called the American Academy of Professional Coders. Now they just like to go by AAPC. So they offer the certified professional medical auditor credential, the CPMA.
Oh, you pursued this way back when.
Yeah.
And now it's like a hot credential that everybody's getting.
Right. So I had to do my homework and find out, well, what kind of credential even exists that could possibly validate that I have the skill set, you know? And that's part of the reason why I'm such a big proponent of telling people, go out there and study for exams and take those certification exams. And the reason for that is when you do not have work experience, when you are either a fresh out of school graduate or you really don't have a lot of experience or experience in the specialty you want to get into, the only way that you can compete with other candidates for that job, the only way that you can establish yourself as somebody who is minimally qualified to even apply for that role is to have those credentials behind your name. That's essentially the only way to be able to get in there and have a solid chance at landing the job. I mean, the rest of it is up to you with the interview, but you remember, whenever you are applying for a job, the first thing that people see, they don't see your face, they don't get to talk to you, they only see that printed name and credentials on that resume. That's it. So it's almost like you have to do that because that's your first opportunity to impress. And it's on paper, unfortunately, but it is what it is. So that's what I did. I sat for the CPMA after studying.
Wait, so was that your first credential or did you get the RHIT first?
Well, I kind of did them. Like, believe it or not, I didn't take my RHIT right away. So even though I did graduate from a 2-year program, because I was working as a medical coder, the first thing that the employer said to me is, you know, we'll give you 6 months before you have to absolutely take and pass some sort of medical coding certification exam. So they gave me a list of them, and they were really from AHIMA, the American Health Information Management Association. So they told me the certified coding specialist, the CCS, or the certified coding specialist physician base, the CCSP, or the RHIT, the registered health information technician. So I said, okay, I'll start off with the CCS, which is a little bit of inpatient and outpatient. And I took that one first. And then I took the RHIT because I really wanted to have time to study for the coding, because it was directly tied for me, you know, to me keeping that job.
That's right. You know, that makes sense.
Yeah. And then I did the RHIT, and haphazardly, I was kind of studying for the RHIT while I was trying to prepare for the CPMA. And I remember at the time, my supervisor said to me, well, why don't you do the E&M one first, the evaluation and management credential? And I said, okay. And I thought to myself, well, you know, auditing for outpatient clinics, a huge part of it. I mean, the most common CPT codes that are used are the evaluation and management codes. That's how physicians and non-physician providers bill for their time with their patients. So it made sense. So I did sit for the Certified Evaluation and Management Certification Exam, the CEMC. I did that through the AAPC, and then I took the CPMA. So I did one before the other, but I really needed to understand evaluation and management. And that was challenging. It was challenging at the time. And back then we used the 1995 and 1997 documentation guidelines for all the E&M codes. But you know what? I found out, just like everything else in life, the more you practice, the more you understand it. The true test of you knowing what you know, that you really truly do know your craft, is when you can teach it to someone else.
That's right.
And my supervisor said to me, well, guess what? Now that you've taken it, I want you to teach all of our coders how to do evaluation and management coding. And I was like, oh boy. But you know what? It was great practice, because if you're going to be an auditor, you've got to be prepared to sit down with healthcare providers and explain to them why their E&M code selection was not the best one, why it wasn't appropriate for the documentation that they provided. And, you know, what better practice than to practice with my colleagues? So that was fantastic. And so that gave me the confidence, not just the skills, but the confidence to be able to sit down with physicians, because I had already taught some of my colleagues. So that's how I got into auditing.
Okay, so I'm going to take a lucky guess here. Is that what piques your interest about education, or how did you transition to academia?
So initially, like I said, it was really the labor board, the labor department, that got me interested in just going to school for that 2-year degree, the associate's degree. But when I found out that in order to serve as a manager or a supervisor in most health information settings, like hospital settings, or even in a busy multi-physician practice office, you really needed to have a bachelor's degree. Mm-hmm. And in fact, AHIMA, the American Health Information Management Association, they will only allow a candidate to take the RHIA, the Registered Health Information Administrator exam, if they have a 4-year degree or equivalency.
Right.
And so now I had to really think about going back to school. And obviously that's a very big decision, you know, just like, you know, purchasing a home or a car, or, you know, having children. It's a big decision. And so, you know, I had to give it careful thought, but I looked at it at the time as like, well, financially, I may not be in the best position to do that. But, you know, I applied for student loans, government loans, and that's how I was able to do it. And at the time, I'm going to be honest with you, there are advantages to the world going remote, totally online overnight with our pandemic. I know it's an unfortunate situation, but you know, there are advantages to being in a program that's convenient, where you can do your homework, your classwork all online whenever you want. Back then, when I went back to school, there was no such thing. You had to go to a physical classroom, which meant that you had to carve time out of your evenings, your weekends, you know, whenever school was, and kind of position your job around it and hope that your employer was understanding about it.
You're absolutely right.
So yeah, so I did that. And once I graduated, then I was able to sit for the RHIA exam. And that opened up doors, because at that point, not only was I qualified, minimally qualified to apply for those supervisory and management positions in health information, but now I was even able to teach. And actually, I was offered an opportunity to become an instructor for, believe it or not, to teach auditing. And I thought, well, that's great. I happen to love that. That's probably one of the specialties or subspecialties about health information that I absolutely love. Because for me, it's detective work. You know, you're reading through charts and encounter notes, and you're trying to piece things together with the billing. And verifying that the documentation was signed and dated, and that, you can identify the credentials and the name of the provider, and that there's no discrepancies within the health information that's being presented and what's being billed out. So I love that. I was so excited about that. And I was like, great, I would love to do that. So I did. I started teaching probably from 2014, just as a part-time instructor. Okay. And eventually I got to the point where I started to work full-time as a health information management educator for various different schools, different universities. And right now I'm serving as the program director for Beale University.
So, okay. So when you introduced yourself initially, you made it a point to say that you still have your toe in the industry.
Absolutely. So yes. So I am dead set on recommending that even if it's on a part-time basis or a PRN basis, it's so important to work a few hours as often as you can, getting your hands in there and doing something in HIM. So I like to do medical auditing on the side. So I work part-time just as a contracted employee. I just do a few hours a week, but it keeps me not only up to date with any changes happening. For example, in 2021, on January 1st, the AMA just developed a whole new way of doing outpatient evaluation and management coding. And we had to switch gears, switch brains, and learn how to apply that to the American Medical Association's medical decision-making table. And so I had to learn that before I could teach that to someone else. So the only way that I could get good practice was to be employed and constantly doing it. So I make it a point to always do a few hours of work on the side, because I think that's so important. Because again, our industry relies it's so intertwined with technology. It really is. There's no escaping it. You work with electronic health record systems. You work with all kinds of coding systems. You work with artificial intelligence that are embedded into those coding assisted systems. And so there's no way around it. And the only way you can keep up and be really confident in what you can bring to the table in this role or in this industry is if you keep up to date with the changes. And those changes, they're always coming. They're consistent. The only thing you can be sure of is that consistently everything will change.
Right. I love you say that because, I too am an educator, and that's something that I've always struggled with, because you get to a point where you feel so out of touch. And, you go to conferences, you try, you have your advisory meetings, you have people keeping you up on the industry, but it's not like being there. It's not like being in it yourself and learning and having that firsthand information.
Definitely not. There's nothing like it. And certainly I also recommend that anyone who's in the field, whether you're a student, whether you're a seasoned employee, professional, you definitely want to belong to any of your local membership organizations, whether it be the state chapter for AHIMA, whether it be your local AAPC chapter, or some other allied health membership body. Because again, the more that you participate in learning about things that are coming up that might be instrumental in your job, or might be just something of interest or of use to you down the road, that keeps you very current. It keeps you really marketable, because remember, you can put that on your resume and say, I've had training in this, I've had some experience or exposure to this. All of that is very, very helpful, because that's the other piece of it. If you want to stay employed, you've got to show the employers or your prospective employers that you make every effort to stay current, because everything is changing. When we started making this transition from ICD-9 to ICD-10 on October 1st of 2015, a lot of people, they were so afraid of the change because it was just so daunting. In theory, it was just too much of a lift. and they decided they were going to retire from their profession, which I thought was such a shame, because it's like anything else. At first it's scary, and then you get over the hump and you're like, oh, this isn't so bad.
Right. We all like, look, we survived.
We survived. We not only survived, we thrived. And look what we did with all that knowledge. And now, you know, we're trying to get ready for ICD 11.
Right.
So, but that's the beauty of it. It's never a dull moment. It's always a challenge, but a welcome one. In other words, you don't want to be in an industry or a position where everything is stagnant and it's always the same and there's nothing new to look forward to. You know, as human beings, we need to be stimulated. We need our minds to have something to grapple with. You know, that's what makes life interesting. Otherwise, everything's ho-hum and, you know, it won't be long before you'll be bored with your job. So I think that's one of the perks of being in health information, because it is a field that's always growing, always changing, not at an unprecedented rate that it's just unmanageable, but it's always interesting.
I agree. Thank you so much, Liz. That was fantastic.
Oh, I'm glad.
You offered such great advice. Anything else that you would like to share with our audience before we go?
I think possibly the best advice I could give is don't be afraid to reach out and use your networks to find information. You know, we're all connected these days by the internet. Don't be afraid to create a LinkedIn profile and to reach out to anyone you can search online who might be helpful to you, might serve maybe even as a mentor, or might just give you some free advice.
Right.
It doesn't hurt to, you know, make a network of friends or acquaintances, because you never know. The very people that you connect with someday may actually call on you for like any little task or opportunity. And that's a lot of what happened with me. I started presenting on webinars because I made a few contacts online. And after a while, somebody said to me, hey, you know, we need a speaker. Would you be interested in talking about this subject or that subject? And I thought, well, yes, I would. And, you know, as scary as it sounds, you do get over the fear when you realize you actually know more than the people attending the webinar. So it's not, you know, you have to remember that even if you're not that experienced, you're the one who's preparing for it. So you're still more knowledgeable than the audience. So there's no need to be that scared about it.
Doesn't that give you like a different level of confidence?
You know, it's nerve-wracking the first time you do it, and it's nerve-wracking when you do it in person. But, you know, since everything is being done online, literally, most of the time, nobody even sees you. And they, you know, sometimes they don't even have a chance to ask questions. They might email them to you later. But I think it's still good exposure. One, because you do build confidence. You certainly learn how to develop those personable skills. But you also force yourself to really do your homework, you know, prepare for it. And the more you do that, the more you learn about the topic that you're talking about, the more you feel comfortable in doing the next presentation on that topic. And little by little, you'll build a reputation. But more importantly, the people that you connect with, the people who get to know you, get to know your name, they're the ones who are going to reach out to you, call on you, and you never know. A lot of opportunities do happen. Sometimes it's true what they say. It's not so much what you know, but who you know. That actually happens.
That's right. I agree wholeheartedly. You're so right. Such great advice. Oh, I feel like now I even want to talk to you more about confidence and things like that. So we might have to welcome you back again. Well, first of all, you are always welcome. Thank you so much.
Thank you.
Thank you so much for your time today. I really appreciate it. And I look forward to chatting with you again.
I do too. I do as well. Thank you so much. I really appreciate your time and your interest, and I wish everyone well.
You too. Such great advice. Thank you.
Thanks. Take care.
You too. Bye-bye.
Bye-bye.